Welcome, everyone. Today, one of the cornerstones of medical research and critical appraisal, cohort studies, one of the most essential tools in medical research and critical appraisal. These studies help us uncover how exposures, like lifestyle factors, environmental conditions, or medications, affect health outcomes over time. If you've ever wondered how researchers identify the long-term effects of a specific behavior or intervention, cohort studies hold the answers. They allow us to observe real-world dynamics and make sense of complex relationships. They are observational by nature, following groups of people, called cohorts, over time to examine how specific exposures influence health outcomes. Whether it's exploring the impact of diet on heart disease or the long-term effects of environmental pollution, cohort studies allow us to observe real-world trends in action. By the end of this session, you'll not only understand what cohort studies are, but also how they're designed, their applications, and the challenges involved. Most importantly, you'll learn how to critically appraise these studies to determine their value in advancing medical knowledge. So, what are cohort studies? As we mentioned earlier, cohort studies follow groups of individuals, called cohorts, over a defined period to explore the relationship between exposures and outcomes. Unlike randomized controlled trials, RCTs, where researchers intervene by assigning treatments, cohort studies are observational. They let us study the natural progression of events, making them particularly valuable when experiments are impractical or unethical. Let's have an example. Imagine studying the link between smoking and lung cancer. Assigning people to smoke isn't feasible, but by observing smokers and non-smokers over time, cohort studies reveal how smoking impacts lung health. Cohort studies are often used in public health, chronic disease prevention, and evaluating interventions. They're vital for understanding the broader picture and identifying trends that shape clinical guidelines and public health policies. Now, let's look at the two main types of cohort studies, prospective and retrospective, and explore how they work. In prospective cohort studies, researchers start with a group of individuals who don't have the outcome of interest, for example, heart disease. These individuals are then followed into the future to see who develops the outcome. This design measures exposures before the outcomes occur, establishing a clear temporal relationship. Then, what are the advantages of prospective studies? They allow researchers to establish a timeline between exposure and outcome. Since data is collected in real time, there's less recall bias. Researchers have more control over how data is collected, ensuring consistency and accuracy. Let's take a practical example. Imagine you're studying how physical activity affects cardiovascular health. In a prospective cohort study, you enroll participants who do not have heart disease. You record their exercise habits, diet, and other health factors at the start. Over the next decade, you track their health outcomes, such as heart attacks or strokes. This approach reveals patterns, such as how regular exercise reduces cardiovascular risks. The second type is the retrospective cohort studies. Retrospective cohort studies take a different approach. Instead of starting in the present and following participants into the future, researchers use existing records to look back in time. They identify a cohort from historical data and analyze past exposures to determine their relationship with current outcomes. So what are the advantages of these retrospective studies? They're quicker and less expensive than prospective studies. They allow researchers to study rare exposures or long-term outcomes. Example, asbestos exposure and lung disease. Imagine accessing hospital records from the past 30 years to study the effects of asbestos exposure on lung health. You identify a cohort of workers exposed to asbestos and analyze their health outcomes. This approach provides valuable insights without the time and cost associated with prospective designs. Why are cohort studies important? Cohort studies are crucial for answering key questions in medicine and public health. They help us understand disease progression, evaluate interventions, and identify risk factors. Here are some examples of their impact. Public health insights. The Framingham Heart Study is a landmark example of a prospective cohort study. It followed participants for decades, uncovering risk factors like smoking, high blood pressure, and cholesterol. These findings transformed how we approach cardiovascular prevention. Drug effectiveness and safety cohort studies often assess the real-world performance of medications. For example, studies on statins tracked their benefits in reducing heart disease and identified rare side effects like muscle pain, ensuring safer prescribing practices. Occupational health retrospective studies on coal miners revealed the link between dust exposure and chronic respiratory diseases. These findings led to stricter workplace protections. Preventive measures. A study on sunscreen use showed its effectiveness in reducing skin cancer risk. These results influenced public health campaigns and dermatology guidelines. While cohort studies offer valuable insights, they come with challenges that researchers and critical appraisers must consider. Cost and time. Prospective studies can take decades and require significant funding. For example, the Framingham Heart Study has been running for over 70 years, demanding continuous participant retention and data collection. Loss to follow-up participants dropping out is a common issue, especially in long-term studies. For instance, in a dietary study, participants with poor health may drop out, skewing the results. Strategies like remote tracking through apps or offering incentives can help. Confounding variables. Other factors, such as genetics or socioeconomic status, can influence the outcomes, making it difficult to isolate the effect of the exposure being studied. Statistical techniques like multivariate analysis address these confounders. Data quality in retrospective studies. Historical records may be incomplete or inconsistent. For example, handwritten medical notes might miss critical details. However, advancements in electronic health records, EHRs, are improving data quality for research. Let's now look at how cohort studies are applied in medical research. Chronic disease prevention studies on the Mediterranean diet revealed its role in reducing cardiovascular risks. These findings shaped global dietary recommendations. Maternal and child health cohort studies have shown how prenatal factors, like folic acid supplementation, reduce birth defects. These insights improved prenatal care practices. Drug safety monitoring. Post-marketing surveillance studies track the long-term safety and effectiveness of medications, identifying rare adverse effects. Health disparities cohort studies highlight inequities in healthcare access and outcomes, guiding policies to reduce disparities. Now we come to the most important part of this tutorial, the position of cohort studies within the broader hierarchy of evidence, something we've explored in our earlier tutorials. In the world of evidence-based medicine, cohort studies sit in the middle tier. They're not as robust as randomized controlled trials, RCTs, which are the gold standard, but they're far stronger than case reports or cross-sectional studies when it comes to providing evidence about cause and effect relationships. Why? Because cohort studies observe individuals over time, offering insights into how exposures influence outcomes while maintaining a temporal relationship. While RCTs provide definitive evidence due to their controlled nature, cohort studies shine in areas where RCTs are impractical or unethical, like studying the effects of smoking or environmental exposures. Their ability to track long-term real-world outcomes makes them indispensable in medical research. Now that we've placed cohort studies within the evidence pyramid, let's discuss how to critically appraise them systematically. As we all know, Critical appraisal isn't just about identifying flaws. It's about evaluating the validity, reliability, and applicability of a study. So let's have here a step-by-step approach you can use to appraise cohort studies effectively. 1. Define the research question. Start by asking, is the research question clearly defined? A good cohort study begins with a well-framed question that specifies the population, exposure, outcome, and time frame. Example: does long-term physical activity reduce the risk of cardiovascular disease in adults over 40? 2. Evaluate the study design prospective versus retrospective. Is the study design appropriate for the research question? Prospective studies are better for understanding causation due to their temporal clarity. Retrospective studies are efficient, but may suffer from biases due to reliance on existing records. Duration and follow-up. Does the study track participants for a long enough period to observe meaningful outcomes? For instance, studying the impact of diet on heart disease requires years, not months. 3. Assess the population and exposure population selection. Is the cohort well-defined and representative of the target population? A poorly defined cohort can lead to selection bias. For example, enrolling only urban participants in a study on diet may not capture rural dietary patterns. Exposure. Measurement. Are exposures clearly defined and measured accurately? Look for objective measures, e.g., biometrics for physical activity, rather than self-reported data, which can introduce bias. 4. Examine the outcome definitions. Are the outcomes clearly defined and consistently measured? For example, if studying cardiovascular health, are the outcomes limited to major events like heart attacks or expanded to include minor symptoms? Blinding of outcome assessors. Was there an effort to blind those measuring outcomes to participants' exposure status? This reduces observer bias. 5. Consider confounding and bias. Confounding variables. Does the study identify and account for potential confounders? For example, when studying exercise and heart disease, factors like diet, smoking, and socioeconomic status must be addressed. Statistical adjustments like multivariate regression or propensity score matching help mitigate these issues. Bias. Are there signs of selection bias, recall bias, or information bias? Retrospective studies are particularly vulnerable to these, so check how the researchers addressed them. 6. Evaluate data quality and analysis. Completeness of data. Are data points complete, or is there a significant loss to follow up? Studies with high attrition rates may not provide reliable results. Statistical methods. Were appropriate statistical methods used to analyze the data? For example, hazard ratios are often used in cohort studies to measure the relationship between exposure and outcomes. 7. Analyze the results. Clarity of results. Are the results presented clearly and concisely? Look for absolute and relative risks, as well as confidence intervals. Strength of association. Does the study demonstrate a strong association between exposure and outcome? For example, a study showing that smokers are 10 times more likely to develop lung cancer provides compelling evidence. 8. Consider the study's applicability relevance to practice. Can the findings be applied to your patient population or research context? For example, a cohort study on diabetes in Asian populations may not fully apply to Western populations due to genetic and dietary differences. External validity. Are the results generalizable beyond the study population? 9. Identify ethical considerations. Ethical approval. Was the study approved by an ethical review board? This is especially critical in retrospective studies that use patient data. Informed consent. For prospective studies, did participants provide informed consent? Putting it all together. Once you've gone through each of these steps, ask yourself, does the study provide valid, reliable, and actionable evidence? Are the findings significant enough to inform clinical decisions or public health policies? For example, after critically appraising a cohort study on sunscreen use and skin cancer prevention, you might conclude that the evidence strongly supports recommending sunscreen in routine care. By following this systematic approach, you'll not only identify the strengths and weaknesses of cohort studies, but also gain the confidence to apply their findings in practice. In order to wrap up this tutorial, let's summarize the value of cohort studies. As you have seen, cohort studies, whether prospective or retrospective, are invaluable tools for understanding complex relationships between exposures and outcomes. They provide insights that shape clinical guidelines, public health policies, and patient care. As you evaluate cohort studies, remember to assess their design, strengths, and limitations. This critical appraisal ensures that their findings translate into meaningful advancements in medicine. Thank you for joining me in this session. I hope these expanded examples and detailed insights have enriched your understanding. Let's continue exploring more tools and methods in future tutorials. Thank you and see you soon.